evidence-based study, a single-arm prospective observational study we had conducted, and I think we all know that the therapeutic parsimony is one of the very important goal while managing our diabetic patient, especially when diabetic patients there is a high chance of different comorbidities, multimorbidities, and patient will take multiple drugs, polypills, polypharmacy is an important issue. So if we can reduce the pill burden, reduce the injection, so that could be always helpful. So our study was done with a fixed dose, when the fixed dose combination of glargine and lixisenatide had been launched in India. We know there is one cutoff which when we call oral anti-diabetic agent failure, and that OAD failure generally we assume, though that definition not that much universal, but we took that definition as when the patient is already on 3 drugs and one of the 3 drugs should be the sulfonylurea and the metformin, and then on top of that another one more drug, and the patient is not achieving the glycemic goal. At that time we start insulin. Here we start the Lixi and glargine combination, and this was a 3 months duration study where we estimated, we see the changes in the fasting plasma glucose value, postprandial glucose value, and HbA1c reduction at 3 months. Also we check for the body weight reduction, different adverse effect profile, and what is the main result? Main result was after 3 months we got 85 patients got completed, and among them the 8 who had discontinued, they were generally due to cost effect, and some of them were having gastrointestinal adverse event. So the fasting plasma glucose reduction from the baseline, it was around 52, whereas it ranges, the confidence interval was around 30 to minus 30 to minus 80, and that was statistically significant. And when we talk about postprandial glucose reduction, it was around 92 milligram per dl. When we talk about the confidence interval, it was again starting from the 70 milligram per dl to 175 milligram per dl, and that was also statistically significant. Most importantly, the HbA1c reduction was around minus 1.73%, and the confidence interval was minus 1.5% to minus 2.8%, which was also statistically significant. Most importantly, in our study, we had also analyzed the weight reduction, and it was almost around 3.62 kg reduction, and again the confidence interval for this particular study was minus 2.5 to, in some patients, the upper level of confidence interval was minus 4.55 kg in 3 months. The weight reduction was also statistically significant. In the study cohort, the 85 patients who had completed the study duration, we got 8 patients who had mild gastrointestinal adverse events, and there were 2 cases of mild documented hypoglycemia. So to conclude, from this first real-world evidence study that had been conducted in India after the launch of Lixi and glargine combination, fixed-dose combination, that we can tell, yes, it had shown effectiveness, real-world effectiveness had been shown from this particular study. Yes, there were weight benefit. When we all are scared with insulin therapy, that would be a weight gain. But in our study, we found that when it was being combined with lixisenatide, a GLP-1 analog, it reduced weight, and there were minimal hypoglycemia that had been also documented in our study. So we can say when there is poorly controlled type 2 diabetes patients who were on 3 oral glucose lowering agent and we are not achieving the glycemic goal, if we start with this Lixi and glargine combination, that could help us in a safe, simplified, intensified strategy to reduce glycemia, reduce hyperglycemia. At the same time, we'll get less hypoglycemia and less weight gain. Rather, we get some benefit in terms of weight loss around minus 3.5 kg. So this was from our study. So thank you very much.